I'm Dr. Binod Thakur, a board-certified allergist. I specialize in managing complex problems related to allergy, asthma, and immunology. We take care of chronic and recurrent sinus problems, hay fever and environmental allergy, severe difficult to control asthma, recurrent infections, eczema and skin allergies, hives, and anaphylaxis, which is life-threatening serious allergic reactions, stinging insect allergy, food reactions, drug reactions, latex reactions, chemical reactions, metal allergy, allergy to implant materials. We are seeing a lot of those these days. And also immunology problem, particularly people with recurrent, chronic, persistent, unusual, or atypical infections. Most of the allergy problems are mild and they can be handled by their primary care physician. If it is a persistent problem, severe problem, difficult to control, or recurrent problem, they should consider seeing a board-certified allergist. We use a wide variety of evaluation methods to come to a diagnosis. We use both allergy skin test as well as blood test depending upon the situation, for environmental allergies, for food allergies, for stinging insect allergies, for drug allergies. For contact allergy, we use patch test recommended by American Contact Dermatitis Society. For complex immunological problem, we would do different kind of blood test. We also manage asthma, so we will do a spirometry and if needed, exhale nitric oxide to evaluate for eosinophilic inflammation in the lungs. It depends upon the situation of the patient. If it is acute problem and it resolves, they will continue follow-up with their primary care physician. For chronic, persistent, recurrent, severe conditions, generally we will monitor them until they are well controlled or resolved. So we will, after making diagnosis, we will initiate a treatment plan and then monitor the response and adjust the medications and treatment plan depending upon the individual. In our practice, we try to individualize the treatment plan. So person A with allergies may be different, their body might respond differently than person B with allergies. In our allergy practice, we have comprehensive and holistic approach to the management. Our main aim is to identify the problem so that we can eliminate the need for ongoing treatment. So if allergen is identified, somebody has eczema for a long time and we identify the allergens they are sensitive to, often by avoiding those allergens, their problem improves a lot and they might need much less medication. So identification and avoidance is our first priority. We will use different kind of medications to control the problem, but many times we will try to change the way body reacts. And in many cases, we can successfully desensitize and help patients build up their own immunity and tolerance so that going forward they have less need for medications. We can do it with the help of allergen immunotherapy and other immunomodulatory therapy. It has been successfully done for 100+ years for environmental allergies, for hay fever, chronic recurrent persistent sinusitis and sinus problems. And it is extremely effective for stinging insect allergies, particularly for those people who have had life-threatening and serious reactions to that. We also do biologicals, the newer biologicals for severe and difficult to control asthma. We specialize in treating with certain biologicals such as the new ones, Xolair and Nucala. For immunodeficiency patient, if the patients need immunoglobulin replacement therapy, we would arrange for that as well.